Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the high resolution endo board CBCT requested of the lower right 4, 5, and 6. This is the 3D rendering. Moving to the half of the panoramic view, you can see this is the lower right 4, the lower right 5, and the lower right 6. We see a radiolucency around the lower right 6, which is also communicating with the lower right 5. This is the inferior alveolar nerve. Moving to the transaxial view, at the transaxial view, this is the lower right 4. Just zoom in for you. Moving to across the 4, we can see that there is absolutely sclerosed canals. We see very minimal signs of a canal here, but absolutely sclerosed canals are seen, and we don't see any signs of. And this is at 75 micrometers, so a very thin slicing, and we don't see any major signs of a canal morphology. Just a faint idea right here in the middle, but nothing significant. Moving to the lower right 5, here also we can see that we put a very sclerotic tooth. Mid root level, we can see that there are signs of a canal morphology opening up in the apex, and this is where the periapical radiolucency can be seen. This tooth at the distal aspect, can see that the periapical radiolucency is present here as well. Moving to the lower right 6, in the lower right 6 region, this is the mesial root. We can see that the periapical radiolucency is present right here, right there. And we see very little canal morphology. This is the interradicular area, and the radiolucency is present here as well, along with furcation involvement. Moving to the distal aspect or the distal root of this tooth, again we see very sclerotic canals. We see very small area of a root morphology, but otherwise all three of the teeth show very significant sclerosis of their root morphology. Moving to the axial view, at the axial view, we can see barely see a canal morphology in the 4, barely see it in the 5, and also in the mesial and distal roots of the 6. So this all three teeth appear to be very sclerotic. The canal morphology seems to be absolutely negligible. We are quite surprised to see such a sclerotic tooth at the moment. If you have any further questions regarding this case, the lower right 5 and 6 have periapical radiolucencies associated with them as well. Thank you very much.